Hearing aids are a great way for millions of people around the world to deal with the problems that come with hearing loss. These high-tech gadgets give the gift of sound, which improves communication and the quality of life as a whole. But people who want to use hearing aids or are just starting to use them often have a lot of questions and worries. One common question is whether hearing aids can cause breathing problems. In short, hearing aids themselves do not cause nose problems most of the time. But to answer this question correctly, you need to know more about both hearing aids and breathing problems. Understanding sinus issues. Most sinus problems are caused by swelling in the sinuses, which are hollow spaces in the bones around the nose and forehead. This inflammation can cause many different symptoms, such as stuffy nose, headaches, facial pain, and a lessened ability to breathe. Sinus problems are often caused by viruses, allergies, or physical problems like a crooked septum. What hearing aids do? Hearing aids work by making sounds louder, which makes it easier for the person to hear and understand words. Most of the time, they are worn in or behind the ear. They don't touch the nose or sinuses directly. But sometimes people may think there is a link between their hearing aids and breathing problems. Several things could possibly have led to this impression. 1. Allergic reactions. Some people may have an allergic response to the materials used to make hearing aids, such as certain types of plastic or silicone. This allergic reaction could cause signs like itching, redness, or swelling of the skin. Even though these signs could be confused for sinus problems, they usually show up around the ears, not in the sinuses. 2. Ear pressure misinterpretation. Hearing aids that don't fit or aren't set up right can sometimes cause a feeling of pressure or pain in the ear. This could be misunderstood as sinus pressure, especially if the person has sinus problems a lot. 3. Referral pain. Sometimes, problems in the ear can make other parts of the head, like the sinus area, feel painful or uncomfortable. This kind of pain is called referred. Even though it may seem like the hearing aid is causing a head problem, the pain is coming from the ear. How to answer possible questions. If you think you have breathing problems after starting to use hearing aids, you should talk to a doctor right away. They can help you figure out if your symptoms are really caused by head problems or if they are caused by something else, like an allergic reaction, hearing aids that don't fit right, or referred pain. Here are some possible steps. 1. Talk to an audiologist or ENT specialist. These experts can look at your ears and hearing aids to make sure they fit right and aren't causing any pressure or pain in the ear. 2. Allergy testing. If someone thinks they might have an allergic response to the materials in a hearing aid, an allergist can do tests to confirm this. If you really are allergic, you can look for hearing aids made of different materials. 3. Get regular checkups for your sinuses. If you've had sinus problems in the past, regular checkups can help you handle your condition well and figure out what might be causing it. Conclusion. Even though it's normal to worry about the possible side effects of a new medical device, it's important to remember that hearing aids are made to keep their users safe. Most of the time, they are not linked to nose problems. But if you feel pain or have other strange symptoms after starting to use hearing aids, don't be afraid to see a doctor. Misconceptions and fears about hearing aids can be put to rest by knowing and learning more about them. By doing this, we give people the power to use these products to their full potential to restore and improve the richness of sound in everyday life.